Good afternoon, Vicki.
Hello.
Today we are just finishing up your treatment, fine-tuning some bite and so on. This is May of 2014. When did we meet you?
First time I came was August of 12.
Okay, 2012. So tell me briefly what your story was before you came here.
I had pain in my jaw since the December before that.
Okay, this would be 2011?
Yes.
Okay, which area would that be?
It would be over here. And I couldn't open my mouth very far without pain. I couldn't chew without pain. I couldn't yawn. I had to suppress yawns because it hurt to open my mouth that wide. So that was my main problem.
Okay, and then tell me about that. What did you, you went to your dentist, I'm sure?
I went to my regular dentist.
Dr. Saladin.
Yes, and he's referred me to an orthodontist, and the orthodontist did
That's Dr. LaFurla?
Dr. LaFurla. He did all kinds of testing and decided to refer me to an oral surgeon.
Why?
Because he couldn't.
He felt like that?
Yeah.
Okay.
So I had some, I don't know, the MRIs done and went down to the oral surgeon and he looked at the MRI.
This is in Arkansas? And what is the doctor's name?
Scott Bolding, I believe.
Okay.
And he looked at the MRIs and told me that I have degenerative bones and joint was almost gone, and the whatever the stuff is in between, I don't know what it's
in
called.
your jaw joint, TM joint,
in my joint.
and your disc is gone.
It was gone, and he said the only way to fix it was to replace my jaw with a titanium jaw.
Artificial joint? Okay.
And he said, you know, you can do one, but other ones start to do that, so you might as well do both of them at the same time.
Okay, so his recommendation was to artificial joints on both sides. Okay. What are some of the problems he told you might be the issue with that?
I don't remember him giving me too many, like what it could do or what the final result would be, until I went home and did a lot of research myself and on the internet and saw the things that I'm like, I don't want to live that way. And I talked to Dr. Saladin, and
I think
he
he also
do not want to do that.
He also strongly recommended don't do that.
Yes, he said you do not want to do that.
I think he did some research and found us.
And found you. Yeah.
Okay. So briefly so this is obviously for other people to see. After being told the only choice you have is jaw joint replacements, how did your experience here? What all did we do? And
my experience here?
Yeah.
Oh, well, I came here and told you everything that was going on, and you did a lot of testing.
Right. We measured your muscles and all that stuff.
Right.
Okay.
And you told me you thought you could help me. And
Okay.
it's been a long process, but it's been worth it because I'm really good. So.
Okay. Well, thank you. But just as far as the process is concerned, we did something temporary first for 90 days.
An orthotic thing.
Right. Because we didn't, I couldn't tell you do this, but I wanted to see if I can improve your situation first.
Right. And the orthotic, after I had that for a while, I don't remember how long.
Total 90 days. I think you started feeling better sooner than that.
It started. It took a little while, but it finally got to the point where my jaw was not hurting anymore, and I could open.
Yeah, the whole thing was 90 days. Within 90 days.
Okay, so I guess you decided then that, hey, this is going to work. So we went.
Right, and you had to decide more than me.
Yeah.
Because I can measure stuff, but only you feel things.
Right.
Right. Okay. And these are some of the things you mentioned. Right side jaw pain was your #1 issue. You couldn't open your mouth very far, and your neck was hurting. You also had a bite that was inconsistent. You also mentioned hip pain on the right side, arm pain on the right side, and you have some steroid injections for the hip. And I'm not connecting all of those, but kind of connected. So tell me about those. Tell me about the jaw pain. Do you have any of that now?
No, I don't have jaw pain anymore. I don't know if it's even done any clicking just recently.
No.
It had, but not recently.
Okay. And how about the being able to open without hurting?
I could open all the way.
Can you demonstrate? Okay. All right.
I couldn't do that before, so.
And how about the neck problem?
I can turn my head a lot farther either direction than I could before, like when I'm backing up.
Okay, like show me how.
So I can do this a lot farther than I could before.
You couldn't before. You did tell me that you had some degenerative neck problem before.
And so, you know, it's never going to be perfect, but it's better than it was.
Okay.
And I had forgot what they called it, in my shoulder.
Right shoulder, labrum,
Forgot what the name was.
rotator cuff.
Impingement.
Okay.
Impingement in my shoulder, and I was getting ready to do surgery on it.
Actually had it scheduled
I had
already.
it scheduled, and you told me, let's give this a chance, let's try yoga, let's do all these kind of things, and don't do the surgery. And I was like really reluctant to not do the surgery because it had been that way for over a year.
But I felt like if I can correct the jaw and neck with the physical therapy and so on, I expected things to improve.
And so I gave it a chance and canceled the surgery, and I'm much better, and I'm not going to do the surgery now. My
No need
shoulder
to.
has very much improved.
Good,
So.
good. And you did have many options given, meaning after the orthotic was done, you chose a particular option, which was to do orthodontically correct your arch form, because you had braces done a long time ago, had some teeth taken out and so on, kind of undo some of that, and full mouth reconstruction. That's the option that suited you,
Yeah.
the one that you chose. And you already kind of said that. Now that you have gone through all of those, the braces as well as the full mouth reconstruction with porcelain, tell me how you feel about your decision to do that one.
I think that was the right decision. I'm very happy with the results, and I mean, I feel better, I look better, so I think it was the right thing.
Good, good. You did mention it's a lot of money.
Yeah, it was.
Now that you know all this, have gone through all of that, if you were to do it over again, would you do things?
Yes.
Do that again?
It was worth it.
Well, thank you. I know there are other people that will probably be watching this someday that have been told, either by the orthodontist specialist or the surgery specialist, nothing can be done. The only thing you have left to do would be the jaw joint replacement. What would you tell a person like that?
Well, I would tell them the same thing. I was skeptical, that anything could, that this could work, and
Oh, skeptical about me doing this treatment?
Yeah.
Sure.
I was
I
skeptical.
totally get it.
I don't, I have to be shown something and to know that it's.
You're from Missouri, right?
Yes,
Show me.
exactly, show me. And so, but I was at my wit's end, and nobody else could help me, and I thought I might as well give it a try because nothing else is going to work. And so I would tell anybody else, don't do surgery till you.
And you have a little ways to drive every time.
Yes.
You have about how many hours each way?
It's 2.5 hours.
Each way. You live near Joplin, Carthage,
Yes.
all the way to Kansas City.
Yes, and I know you've got people that come from farther away than that.
I know,
I can't
I know.
imagine, but yeah, it was a lot of driving, but the final result is worth it. So,
Well, thank you so much. It's such a pleasure to help you as well.
you too, thank you. Hello.
Tell me briefly, if I can solve one problem for you, what is that one? What is the most important concern for you?
Okay, it would be the pain in my jaw from opening too much or chewing or yawning.
Okay. Now you're trying to connect those two. Pain.
Pain, yeah.
Point to me where the pain is.
Okay, it's right here.
Okay, turn slightly so I can see it better. All right. So, and you did say, and next question is, when does it hurt? And,
okay.
and you already brought up to the point when you open and chewing and so on.
Right.
Any other time that hurt?
Just yawning, those would be the things, yawning,
Okay.
trying to open to eat, and chewing.
Some type of foods cause that pain more than others?
Well, chewier things, something
Give me an example.
hard and chewy.
Like a bagel type of, or meat?
Yeah, meat.
Meat. Okay, all right. And when did this begin?
It started, this particular thing started last December.
Okay, now it is September of 2012, and this start Christmas
Yeah,
2011.
a little after Christmas last year, so it's been
Okay.
like 9 months.
Okay, you said this particular one.
I have had off and on since I was a teenager. Every once in a while, my jaw would kind of pop or lock, and for just a little bit, and hurt that day, and then go away and not do it again for a year or two. So I've had occasions over my life,
Okay, all
but
right.
never like this.
I understand. Okay, and you also had braces done. Was it to correct that? Was it unrelated to that?
No, I had an overbite,
Okay.
so I had braces when I was right after I got married, 23.
Okay. So this jaw locking and so on is even prior to that one?
Yes.
Okay, all right.
And actually, the braces did fix the frequency of the occurrence of it. Because it used
Okay.
to do a lot more than after I had braces, it didn't do it as much.
Okay, all right. And the next concern after that, number one is the pain of the jaw. Number two?
Is the range of motion, being able to open more.
Okay, show me the best amount that you can open without hurting. Okay, and can you open any more even with the hurting? That's about it.
Yeah.
Okay, all right. And you also mentioned yawning would make things painful. Okay. And beyond the first one would be the pain of the jaw pain, second on the right hand side, and then the limited mouth opening. What's the third one after that?
I have really tense muscles in my neck and shoulders.
Can you turn and point to me on the back? Okay, turn some more so I can see. There we go.
Right.
All that. Okay. And how long have you had that problem?
For years and years, I don't know how long. I mean, I've sat at a desk my whole life, and it's always, you know, been an issue.
You're a CPA?
Yes.
Okay. And
Retired now, but worked for many years at a desk and always had pain. So.
okay. So you felt like maybe the sitting down kind of thing?
I assumed it was just from sitting at a desk all the time with my head down or at a computer screen.
Okay. All right. And you also mentioned something about when you get the massage.
Oh, yeah.
Therapist off.
Occasionally when I go get a massage, the person always asks what I do for a living because it's so tight and they don't know, like, how'd you get that way? So.
Okay. So in other words, they must do massage for a lot of people, but they
Yeah.
find it particularly
They always
tight.
mention, wow, you're really tight.
I see. I see. How often do you get a massage?
Oh, not very often.
Okay. All right. Anything else after that? Any other concerns?
No.
Whether you feel like it's related to the jaw or not?
I don't think so.
All right. Thank you. Vicki, you shared with me later something about a hip and so on. Please share with me what you told me earlier.
Okay, for at least the last 5 years, probably a little longer than that, I've had pain in my hip burning down the back of my thighs from when I sit a lot.
On the right side, right leg?
Right, yeah, on the right side, and I've had injections in it, and it's somewhat better, but still there.
Were they steroid injections into the hip? And how many times do you think it was?
I think I've had that done 3 times.
Okay. And that gave you a lot of relief? Okay. And then you mentioned something else on the right side.
I've had tendonitis a couple times on my elbow, on my arm, and I had steroid injection and it helped, and then a year later it came back and the steroid injection didn't help after 2 more times, and so I ended up having PRP, and that finally after a while resolved it.
Okay.
And
so
now I have pain up in this part of my arm.
whereabouts? In the upper arm?
And the upper arm and my elbow joint is always stiff, sore.
And that was done, the hip was 5 years plus, and the right elbow was about?
The elbow was a couple years ago when the first happened, and then the PRP was just within this last year.
Okay. And then the upper arm pain was after that?
It was after that.
Okay. All right. Anything else to add? Anything else you thought of adding?
I don't think anything else hurts, I don't know.
Okay. No, we were trying to see the possible symptoms that may be related to your jaw being misaligned, and obviously, it's quite understandable that you didn't think that may have anything to do with any of this. So as we were talking, came up, I thought I'll add it on.
Okay.
Thank you.